I'm Richard Duncan, an orthopedic surgeon at Watauga Orthopaedics, specializing in care of spinal disorders. This is Greg Cross, our director of physical therapy. Wanted to speak to you guys today a bit about exercise in general, but then about some stretching that Greg and I have come up with that's been very helpful. I preach, if you come see me, you see Greg, we'll preach to you about the importance of aerobic exercise for core strengthening, like walk, bike, treadmill, great for core strengthening. Uh, but also, other sports are very helpful as we get older. It's been shown that racket sports extend our lifespan by about 9 years. There's a lot of movement going on, Greg, balance, hand-eye coordination, thinking. There's a lot of social stuff going on. And so that's why there's tons of people everywhere, especially in Johnson City, Tri-Cities, playing pickleball, right, of all ages.
Probably one of the fastest growing sports in the United States.
Right, and I've been a tennis player since high school, uh, and I've transitioned into pickleball. I still play both. Really enjoying pickleball, but as I've done that, what I've noticed is I picked up more injuries. Um, you and I were looking at my spine X-rays earlier today. I have a terrible spine. We can show that on the screen here. I'll see 30 or 40 patients in a day of all ages, a lot of them older than me, and I might have the worst looking back X-ray of the day. So it's something that I've battled my whole life. I've had surgery. I had a discectomy. So I continue to have problems with my back. And this year has been particularly problematic. I've had a hamstring. I pulled an intercostal, tore something in my hip, some gluteal tear, and then I had another back flare-up. It's just been all year long. It requires me to be out for 4 to 6 weeks. Very frustrating. So uh, I actually was inspired by a patient of mine, and he'll know when he sees this video. But he's about 10 years older than me, and I always like to see him because I feel like I'm seeing the future because his back is about as bad as mine, and this guy is in great shape. He pushes through, and he was in a couple of months ago, and he said, "You know, Doc, you need to try yoga." And I said, "That sounds great, but that doesn't fit into my schedule, and I don't know, it intimidates me a little bit." So, with your help, came up with this stretching protocol. I used to stretch before I would go play, but I was 5 or 10 minutes. That wasn't getting the job done. So, this these exercises that we're gonna show you here in just a few minutes, have been great. It takes me about 25 minutes, and I do that at home before I leave for the court in the quiet where I can relax. And it's made a big difference. And I wish I would have discovered it before now. I know you've known this all along, but I'm a little hard headed. I think that people can see this and hopefully relate to it because of an old guy with a bad back that's stiff, wants to continue to play sports, struggles with that. If this can help me, it can help a lot of our patients.
Well, I think no matter what you're doing, whether it's, you play pickleball at a very high level,
Intermediate.
intermediate, okay. Other people play, recreationally, but the key is that the more mature you get, then you start to lose some of that elasticity out of your joints, muscles, ligaments, tendons, especially with pickleball because it's such a multi-directional sport and everything gets involved when you're on the pickle court, whether it's through your shoulders, whether it's through your neck, whether it's through your ankles, your hips, your knees. All those are being stressed and components of different motions and reactionary times. So it's extremely important to be able to enhance your flexibility, but not just for pickleball, but just for your general health as well.
Yeah, and I feel
Because
these exercises would go along with any golf, uh, running.
exactly.
I think it's good to be more flexible.
I've read some articles and some general components that says that by the time that you're in your early 60s, if you haven't established a level of flexibility, it's very difficult to get that over as you get older. So if if you're involved in other sports, then it does take some time you put a significant amount of time in. Your warm-up routine is regular. You do that throughout the week, but also before you go out to play, and that's extremely important because, um, a 2 to 3 minute warm up makes you feel a little bit better, but you really haven't done anything physiological to be able to change that. So the time period is a factor. Breathing is important, and they'll see that in the video as you breathe and you relax, let your muscles stretch. Um, there's multiple components of exercise. Yoga is great to do. Light strengthening exercises, doing the flexibility exercises, especially the functional types of stretches of what you're doing for your particular sport. Um, I'm not a pickleballer. I like to ride my bike, but I do the same thing. I do warm up exercises, especially through my hips and my legs and my core before I even get out and go and get on my bike. I do warm up on the bike before I start into the
Right.
ride, but I also try to stretch really, really well that following day after riding, a long bicycle ride, and that's become very important for me because I feel the benefits of that as well. But for you, especially who've had this longevity, um, with the injury with your spine, which can be extremely delicate for a lot of folks in regards to pain and discomfort. But you've gone out and you've worked through that. And so, no matter what your disability might be in regards to previous injuries or other post secondary problems that you could have developed, it's important to know that your body can respond extremely well when you do the right type of exercises and the safe exercises to keep you doing whatever that's for activities at home or being out on the pickleball.
And we should mention that for patients that have had joint replacements like total shoulder, total knee, total hip, spine fusion, a lot of these exercises might not be right for them. So they should really speak to their surgeon and their physical therapist because things can be modified, but these exercises might not fit them. So I should
That's
say,
correct. That's correct. Because exercise can be specific for each individual. These are general exercises, but you're taking people through an arena of exercises that really work the entire body in preparation for the sport that you're going to be playing.
okay. We'll look through those and go over these exercises.
Okay, very good.
So, Greg, I like to start off on my back. I bring up a single leg, and I'm trying to flex my hip up as much as possible. It should be noted that this is a almost 64-year-old man doing these exercises, so they're probably not being done exactly correctly, and I'm very stiff. But I think I'm getting some good stretch of the gluteal muscles and the back muscles on that right side, while the opposite side that's flat on the floor, I'm getting some stretching of the anterior hip. Is that right, Greg?
That's correct. You get the opposite side hip. I also note in this position for some people, if you have a little bit more of a problem with your neck, you can always use some support under your neck when you're doing that particular stretch as well.
And I guess if you can't bend your knee all the way, you could, or if you had a knee replacement, they could show you how to do this without bending your knee with your knee out straighter.
That's correct.
I'm going to show that here in a minute. Anyway, I hold these for 30 seconds. I count to 30. I'm relaxing. I'm deep breathing. I'm in a quiet environment. I don't do these when I get to the court. The pickleballs are flying and everybody's talking to you. That's not the time to stretch. I do it at home before I make the ride over. You agree with that, correct?
I do, especially for the breathing that you mentioned, because you get better relaxation. The more relaxation, the better the stretch is
Yeah.
for the individual person.
Okay. 3 of those for 30 seconds. So, Greg, while I'm still on my back, I like to bring my leg all the way out, a hamstring stretch there, and you can see how tight my hamstrings are. I mean, that's just the way I am. So I'm doing my best to stretch that. I'm gonna do a hamstring stretch standing up later, but I'll hold this for 30 seconds also on either side. I know that's poor form, Greg. That's the best I can.
No, really, that's good form because your hip, where your leg is back. So it doesn't matter what your angle is. It's just the point where you, as an individual, feel that stretch, and that's the key. Because if you feel that stretch, you're enhancing the ability to stretch. So you don't want to start out with your hip and your leg at a 90-degree position because then you really wouldn't need to do much of that. But the important thing is the form, and the form is excellent because your back's relaxed, your other leg's relaxed. You got your hand is doing the holding the stretch for you, and then you're going through your breathing to help make sure you stay in that relaxed stage.
Okay, so I'm continuing here, bringing my hip up and I'm rotating it. Um, I feel like I'm getting some really good stretch of all my hip rotators on the back side there, and hold that for 30 seconds on either side.
Yeah, you're getting good stretch to that portion of your hip, but you're also getting some of your groin or adductor muscles as well too with that. And you're also keeping your knee in a bent position, so that helps to stretch your quadriceps a little bit as
Yeah, so I'm holding each of these for 30 seconds. If you have an arthritic hip or stiff hip, this is going to be probably not one you're going to be able to do. But this is good for the groin, which is a something that's frequently injured here. The the next one that I do, I really don't like it, Greg. It hurts. It stretches that piriformis, and I'm tight there. But I know it's very, very important because I pulled this recently, and it was a six
well.
weeker.
So this is extremely important because your piriformis muscle or attaches to your sacrum and then coming over and attaches to your hip. So it's a you don't really think about that being a lower back, but that component of your hip that connects into your sacrum has to be able to be flexible too, because it's not, it's going to take the pull straight directly into your lower lumbar spine area. So it's extremely important.
Yeah, I do it on both sides for 30 seconds. We're going to get a little bit different stretch of the piriformis when I move over to the other side and more of a dynamic way. It should be mentioned a lot of these are static stretches starting out, and then we'll move to more dynamic stretches. Now I'm bringing both knees up, uh, and I'm trying to get my knees up as far as I can. I'm getting a lot of good stretch in the back and the gluteal muscles. Also, I'm getting my gluteal muscles off the floor. I'm holding this for about 30 seconds.
And so you also get stretch into your lower back, but in that position and that laying down, you're protecting your lumbar spine while you're going through that more advanced stretch.
Okay. So Greg, these look like nothing, but these are really important. So these are pelvic tilt
That's correct.
exercises. I'm not using my legs to lift it up. I'm just lifting up a small amount. It's important to see I'm lifting that up, and then I'm letting my back come back down, and I'm arching my back and relaxing it. About number 3 of these, I do 10. About number 3, I feel a clunk in my back. That's okay. That shouldn't worry people. That's just your facet joints. You'll feel them moving, and they need to move. That's important.
Yeah, that's the great part about the stretch when you can feel that even though it doesn't look like your spine's moving, is you contract your abdominal muscles to put you into that tilt position that it elongates your spine. And so that will, I call it a release, which means tight tissue, tight joint, that click is a release of the joint and that enhances the mobility.
After 10 of those, I'm going into these bridges. Uh, Now I am using my feet to lift myself up there. I'm starting to do some dynamic work here, activating some muscles anteriorly and posteriorly, along with stretching. So I do 10 of these. I don't get in a hurry. I'm going slow with those. And then I come up into a sitting position, and I don't even know what to call this, Greg. What do we call this?
Well, when I was much younger, I call this the Indian stretch.
Okay.
So it's just it's a stretching your groin, your adductor muscles. You're also getting some stretching into your lumbar spine, but you really get a lot of isolation into those adductor muscles on the inside part of your thigh because those come from your knee all the way up and up into your um, pelvic area, and they work extremely close with the hip flexor muscles, so you're getting a good stretch to that area, which is very well isolated.
Great. All right, Greg, I then switch over to my belly, and I do this extension stretch, and I hold it for about 10 seconds. And then I go down into this flexion stretch. I try to get my gluteal muscles back against my feet if I can. So I really feel like I'm getting a lot of good flexion here. I hold this for 30 seconds.
So you're this is called a child's pose. This is a um, really excellent back stretching exercise for your lower back and your hips. And then you reverse that and you go into what's called extension. So this is called a press up. So you're working both lumbar flexion and extension, but you're doing it in a very safe arena because you're not putting, you're letting the amount of force that you feel comfortable with you, that you can control that with your hands as you go into that extender position.
And I feel like the second and third time I do it 3 times for 30 seconds this pose, and then 10 seconds with this press up. But I feel like that second and third time as I come back, I really can feel like I'm loosening up. I can really feel it.
And it's important that, like you're doing, you're keeping it in that position where you feel the stretch, but it's a comfortable stretch. You're not trying to force a stretch over the period of what your muscles, ligaments, tendons won't allow you to do.
Right, I do not get in a hurry, that I'm really taking my time and changing between, positions. So still mostly static stretching here. So Greg, the next, exercise involves some static and, dynamic stretching. I'm gonna go down, you said this was a modified pigeon stretch?
Yes, that's correct.
I do this for 10 seconds. I feel like that down hip just get a lot of stretching also, really on both sides. And then I'm going up and I'm extending my chest for 10 seconds.
And you're keeping your spine in a neutral position, which is really good. But with the active stretch, you're correct. You're getting both sides working. One is in the fixed position, the other one's more in active position. But you're getting be able to get that to both sides of your hips and your lower back. And then when you come up here, and you're well supported, so your spine's in that neutral position. But as you lean back, you're getting a little bit more load into extension to help with your lumbar motion.
Yeah, this is the same feeling I get when I do that piriformis stretch, when I go into that position. I think that's very important because I'm very tight there and I'm prone to have injuries in that area. And if that's not loose, then the rest of my back is tight. So it makes a big difference in the way everything functions.
I like the way that you've added the active component to this stretch, but you're doing it when your spine's in that neutral position, so it's really safe to do.
All right, Greg, I like to go against the wall to start the gastrocsoleus stretch. It takes me a minute to get positioned, but the back leg, I'm really getting a good stretch down on the Achilles, and then that right leg, you can see I'm getting a good gastroc stretch there, and I'm holding this for about 30 seconds, really letting it loosen up.
Yeah, and the holding that for the longer period like you're doing there, because you got 2 different muscles, like you mentioned, the gastroc and the soleus, they both attach into your Achilles tendon. So, to get the tendon, because it's so thick, you need that time period for it to feel like you're getting a full stretch through it. But you are able to stretch both of those particular muscles in one position, so that's very efficient to be able to do it that way.
That's right. It's super important. Achilles injuries and foot injuries are the biggest injuries I see in pickleball. Now I'm going to do some dynamic exercises here, just raising up. That's working on my gastroc soleus Achilles, but also down at my feet. I do these exercises in my sock feet because I want to feel my feet on the floor. And if you've got tight Achilles, you're gonna put stress on your plantar fascia. So I think this is important.
Especially when you get your weight through both big toes, because that's where majority of your weight comes, and that really helps work those intrinsic foot muscles like you were talking about as well.
Then I go into the quadricep stretch on either side. I'm trying to relax that muscle. I'm holding that again for 30 seconds. And with my other arm going up, I'm getting some stretch in the anterior shoulder muscles also. And I'm getting some dynamic work on the down leg,
Yeah,
starting to fire.
yeah, because you have to stabilize with your hip in order to keep your foot in that position on the down leg. But the good thing is that also with you stretching your arms, but you're keeping your body supported so that the stretch is more effective through your quadricep muscle.
So, Greg, I added this dynamic stretching and activation of the lateral and posterior anterior hip muscles after sustaining a gluteus medius tear uh, proximally that put me out for a month. And so I'm going very slow. I'm going forward and then to the middle and then out back. And I do a total of 5 of these on either side. I'm getting some activation
Um,
on the other leg also. I'm holding onto the wall, but I'm still getting good activation over there.
when you're changing different positions, as you're going forward, out to side and backward, and you're changing the load on your plane through that right hip, or the foot that's down. We call that closed chain, and so you're really doing 2 things at once. You activate the opposite hip, and you're um, a static position, and then you got the dynamics of the other side. So really, really effective exercise.
Greg, I like to stretch my hamstring also standing up. I use the sofa at home, but we have a chair here. This is going to show my inflexibility once again. Uh, but I hold this for about 30 seconds. I'm getting some good stretch on the hamstring, but I'm also getting activated in that down left leg there too.
Yeah, and the thing is that when you're stretching your hamstring, that you're able to do it on a prop so that you can keep your leg and your back relaxed when you're going through the stretch. And so it doesn't have to be in the chair. It may be some people, maybe it's going to be a stool. So I mean, it's just where you start to feel the stretch, but it's a comfortable stretch for you.
And I think it's important to, if you feel like you don't have the balance for this, you can hold on to the wall.
Yeah.
Don't want to fall here. Hi, Greg. Doing some static stretching here, just going sideways, basically one side and the other. I'm holding to a count of 10. I'm getting stretching of the back, the oblique muscles, um, the intercostal muscles, the shoulder, lateral hip. And this tends to be a place where I pick up some injuries in pickleball. So this is important.
And this is a good side bending exercise to get all those muscles. Also, you get your latissimus muscle as well, which starts in your lower back but comes up into your shoulders. You're gonna put a little bit different load, but again, it's other muscles that of the multiple muscles that work together. But this is a different position to be able to get some of those other muscles in a different plane to be able to stretch.
Okay, so I'm holding these for a count of 10, Greg, and I'm doing 10 total, so 5 on each side. Seems to be about right with these sets.
And you've got good balance, so all the motion's coming from your trunk upwards. So it's a good position.
Then some similar starting position. I'm rotating, holding it to 10, and I'm doing uh, the same counting to 10 total here. Getting a little more um, similar stretching, but a little more work with the intercostals, which has been an area where I tend to have an injury.
And you're getting some rotation, but a safe rotation into your lumbar spine as well when you go into each side.
So, Greg, I call this the side lunge. This is a key movement in pickleball, and I feel like I get some good dynamic activation of my hip muscles, some stretching of the back muscles. I can feel it into my calf, uh, and I hold these for a count of 3, and I do a total of 10, so 5 on each side.
Well, it's definitely a multi-directional stretch, which is great because of the different dynamics that you're putting your lower body, your hips and your legs through. And again, that's more of what I would call a functional exercise because that's the function of the things that you're doing on the pickleball court. So it's a really good exercise.
I like to do some shoulder stretches. I'm a left-handed dominant, but I stretch both sides. So I bring that over, hold that for about 10 seconds. And then I also then bring the shoulder in front. So I'm really getting a stretch of the triceps and the posterior shoulder muscles. I do that on either side there.
Yeah, that's really good. The first one, you get also a little bit of stretch into your lumbar spine, but your shoulders are going through so many different planes of range of motion while you're playing overhead to the side. That's a great stretch exercise.
I'm also stretching my neck here on either side for 10 seconds. There, right before that, I was just working on my extensors of my elbow a little bit on my dominant side just to get a little bit of motion. Tennis elbow is huge in pickleball. I see a lot of that. Now, this is just a simulation. I'm left handed, so this is a simulation of a serve toss and a serve coming over just to start to give me a little bit of movement in the shoulder muscles.
But you're very fluid. I've noticed that, which is really good. So you're coordinated. Um, Obviously, you've played a lot. A lot of your tennis background certainly comes out on that exercise.
Greg, this is a forward lunge. Excuse the technique. I'm really trying not to bend my knee more than 90 degrees. This really gets the heart rate up. This is a lot of what we do in pickleball. So I'm trying to keep my back straight. I'm getting a lot of dynamic activation and some stretching there, and I do these to a count of 10, so 5 on each side.
So, you're loading that front leg, that's your, hip and thigh muscle working, but you've got you're not letting your knee come out over your toe on the leg that's coming to the front. See there, your knee's behind your toe, so you're not putting the excessive force or stretch on the knee. And the other important thing that you do too is you let your back leg you have some bend into your back leg knee as well.
And then this is the final exercise before I head out. I'm going down into a crouch. I've got my heels are off the floor, so I'm activating all the muscles in my feet. I'm getting a good stretch. I've got my hands up off the floor. I'm getting some balance there, a lot going on, and I'm holding this for about 30 seconds.
So the load that you get to your big toes, because when in pickleball, because it's multi-directional, especially when you're changing directions front to back, you're going to load that front foot, and so that's a great way to be able to get those what I call the toe extensors to be able to take that load or stretch, preparing for that in pickleball.